Diaphragm. It is a dome-shaped musculo-aponeurotic partition which intervenes between the thoracic cavity and abdominal cavity. Attachments. It consists of peripheral muscular part and a central fibrous part. Origin. It has three origins: sternal part, vertebral part and costal part. Sternal part. It arises from the xiphoid process, that is the lower end of the sternum. Xiphoid process. Vertebral part. It arises by right crus, left crus, median arcuate ligament, two medial arcuate ligaments, two lateral arcuate ligaments. So it has five origins. The vertebral part has five origins: right crus, left crus, median arcuate ligament, medial arcuate ligaments, lateral arcuate ligaments. The right and left crus are attached to the anterior surface of L1, L2 and L3 vertebrae. Costal part. It arises from the costal cartilages of lower six ribs. Insertion. It is inserted into the central tendon. See, the muscle fibers are inserted into the central tendon. Surfaces. It has two surfaces: superior surface and inferior surface. You can see the inferior surface here clearly. So, superior surface and inferior surface. The superior surface consists of two domes or cupula and a central flat part. The two domes of the superior surface are related to diaphragmatic pleura, that is right and left diaphragmatic pleura, and the central part is related to fibrous pericardium. The inferior surface is related to liver and right kidney on the right side, stomach, left kidney and spleen on the left side. Openings of diaphragm. There are three major openings and many unnamed minor openings in the diaphragm. The three major openings of the diaphragm include: number 1, opening for inferior vena cava. Number 2, opening for esophagus. Number 3, opening for aorta, that is the aortic opening. Opening for inferior vena cava. It lies at the level of T8 vertebra. Opening for esophagus lies at the level of T10 vertebra. Opening for aorta lies at the level of T12 vertebra. The structures passing through the opening for inferior vena cava includes: number 1, inferior vena cava; number 2, right phrenic nerve. The opening for esophagus includes the following structures: number 1, esophagus; number 2, right and left vagal nerve; number 3, esophageal branch of left gastric artery and vein. The structures passing through the opening for aorta includes: number 1, aorta; number 2, azygos vein; number 3, thoracic duct. Aorta, azygos vein and thoracic duct. The minor unnamed openings include number 1, opening for superior epigastric vessels. Number 2, opening for lower 6 intercostal nerves. Number 3, opening for subcostal nerves and vessels. Number 4, opening for musculophrenic artery. Number 5, opening for accessory hemiazygos vein. Now the diaphragm is supplied by phrenic nerve and intercostal nerves. Blood supply, it is supplied by musculophrenic artery, pericardiophrenik artery, superior and inferior phrenic arteries. Clinical anatomy. Diaphragmatic paralysis. Injury to phrenic nerve results in paralysis of the diaphragm. Diaphragmatic hernia. It is of two types, congenital hernias and acquired hernias. The congenital diaphragmatic hernias include number 1, posterolateral hernia, number 2, retrosternal hernia, number 3, paraesophageal hernia. The acquired hernia includes number 1, traumatic hernia, that is due to injury, traumatic hernia. Number 2, sliding or hiatus hernia, which is very commonly found. Thank you.